I'm Al Ali, and I'm very excited that you're going to have surgery done with us. And I really would encourage you to spend some time looking at these videos because they're extremely helpful to your recovery. It's an exciting time for you, and we're excited, and we're here to help you. And I think these videos will help get you there. I'm going to be talking to you about your upcoming breast reduction surgery. It's important to know that it's normal to be nervous when you're going to have surgery, so don't get alarmed. That's just part of being human. I'll first start out by telling you that we will give you a set of prescriptions, and I write them on the day that you come in for your pre-operative visit, and they will go to the pharmacy that's on your medical records. And I would really prefer that you pick them up before you come to surgery. So on the day that we see you, please pick them up, because after surgery, it's very uncomfortable and inconvenient for you as you're driving home to pick them up, or your loved ones picking them up for you. So it's best to just get them up front. So please do that. Now, I mark your breasts when you come in 1 or 2 days before surgery. Basically, the markings allow me to figure out where I need to make my cuts and how much I need to do there or here or there, and I use pens to do that. Don't worry about it. The markings will survive. You just pat dry them when you take the showers as you're supposed to. The markings will be photographed after we mark you, because I use them both in planning and as well in the operating room when I'm doing the surgery, and they're very, very important. The day of surgery, I will come in. I'll make sure that your markings are still there and you're doing well, and I will answer any last-minute questions that you may have. After that, the nurses will prepare you for surgery. Anesthesia will come in. They'll say hi. They will also have you sign their own consent for surgery. And then one of my trainees, usually one of my residents, will come in and have you sign a consent that's separate from the consent we have you sign in clinic. It's part of the hospital system. Basically, they have to have you sign that. After that, you'll go to the operating room. Most people don't remember much about going to the operating room because the medications that the anesthesiologists give you kind of make it so you forget. So the first thing you'll remember is being most likely in the recovery room. You'll still be very drowsy, but you'll start waking up. You will have a bra on that either zips or is clipped in the front, and some foam underneath it. That bra does not need to be overly tight. So if it feels tight, loosen it up. Or if you have a bra at home that you prefer, as long as it's not an underwire, you're welcome to use that. Maybe an athletic bra, you could use that as well. But most of the time, the bras that we put you in are fairly comfortable. It's just, we prefer that you do that in the front because it's hard for you to clip a bra in the back when you're recovering. Now, you will be drowsy for quite a while after surgery. Different people take different amounts of time to wake up, but the nurses will not send you home till they've reached the criteria that they have to send you home. Generally, you have to be a little bit more awake and alert. They get you up to get in a chair, and sometimes you have to go to the bathroom, that sort of thing. Now, when you get home, it's very important for you that night, once you're completely awake and alert, to get up and walk at least a few steps. Why is that? Well, the worst possible complication potentially that can occur with any surgery that's longer than an hour, and your surgery is definitely going to be longer than an hour, is that you could develop clots in your legs that can go up into your lungs, and that's life-threatening. The best way we know how to reduce that is to get up and walk. That night, if you're feeling up to it, please get up and walk a whole lot. But if you're still feeling kind of drowsy and stuff, once you're kind of able to, at least a few steps is really a major reduction in our risk. So please do that. That's very important. Now, the next day, we expect you up and around pretty much the whole day, a minimum of 6 times a day, 10 minutes each walking. You can sit in a chair, walk. We don't want you in bed except unless you want to take a nap or bedtime. Bed is bad. Don't spend time in bed as much as possible. We inject every area that we operate on with a local anesthetic that lasts anywhere from 48 hours to 72 hours. It's an amazing medication, and it really works out really, really well. It has changed the way we do surgery. Patients really are much, much more comfortable than previously. The worst pain occurs within the first 6 to 8 hours after surgery, and certainly during that period of time, that medication is very effective. We send you home with a lot of other medications for pain, which we'll talk about at the end of this video. Things that you should do as far as diet goes. The nurses will start you on some ice chips in the recovery room. If you're doing really well, they'll maybe bump you up. If you're not, if you're still a little bit nauseated and stuff, they'll just hold on that. But once you get home, we want you to advance your diet as tolerated. So you start out with ice chips, and if that's good, you can go to liquids, and you can go even more than that. As a general rule, we don't really want you to take anything really heavy the first 24 hours. Things like Jell-O, soups, maybe very light pastas. We don't want you to eat pizza or steak, because if you have to throw up, it's best to throw up something very light than something heavy. After the 24 hours, most people are gonna feel pretty darn good, and they're gonna be able to advance to their regular diet as you would expect in a regular situation. So go ahead and advance as you see fit. Now, all your incisions have glue on them. We don't use any external sutures, so we don't have to take those out. The foam that's underneath the bra is there for your comfort. Don't like the foam, you can take it off, but most people feel comfortable. And generally, by the time you come back to clinic, we will go ahead and have you remove the foam and only use the bra. We don't use drains in anything, even in breast reductions, but we do give you some medications, again, that we'll talk about in the end, that helps reduce fluid from your body. So we reduce the risk of fluid collections, which are called seromas. And again, when I get to the medication part, you will hear a little bit more about that. About 24 hours after you get home, or even a little bit longer, we'd like you to take your bra off, your foam off, and get in the shower. It's important that you don't take a really hot shower, you take a lukewarm shower. And basically at the end of it, you can wash all over, just pat dry your incisions. And if you want to use the foam, put the foam back on and then put the bra back on. We'd like you to take 1 shower a day at least for 30 days after surgery. We feel that that helps reduce your bacterial count as well. It makes you feel better overall. You're welcome to use any soap that you like. I would just prefer that you don't use soap that's heavily scented. So if you have any soap that's hypoallergenic, that would be great. There are some soaps that are just there to reduce bacteria. You're welcome to use those. Just anything that you're not allergic to is okay. And you can put them on the incisions, just don't rub them. What are those 4 pain medications other than the injectable material that we use in the OR? First, we use high-dose Tylenol. Second, we use gabapentin, which is a direct nerve pain reliever. And then the one before last is we use Celebrex. Celebrex is very much like Motrin, but it's a longer lasting medication. And I know some bariatric surgeons don't like you to be on that drug or that class of drugs, but we've had some pretty good success as long as it's a short period of time while you're recovering from surgery. The last medication that is a non-narcotic is a steroid that we use. Now, this steroid is a pack of 6 days of steroids. You start out with 6 pills, then the next day it's 5, 4, 3, 2, so you decrease each day. The way steroids work is they reduce inflammation and they also reduce swelling, which is an indirect painkiller. So we would like you to take that. All 4 of these work on different mechanisms. So you could take them all together or you could take 1 or 2, but except for the steroids, I'd like you to take that all the time. The other 3 you can alternate or not use them or use them as needed. The last medication that we use for pain, and I really discourage you from using, is a narcotic called tramadol. We only give you 10 pills and we won't give you another refill on that. Narcotics have some pretty bad side effects, and in particular, in the kind of surgeries that we're talking about, it can cause significant constipation, so much so that you have to go to the emergency room. So we prefer that you don't use it. Only use it if you absolutely have to. Now, if you're gonna use it, we also give you something called Colace, which is a stool softener. Please use both of those together. If you use the tramadol, use the Colace, it'll help you. Now, if you do anything else that helps you move your bowels, please do that. Whether it's drinking coffee, certain foods that really get you going, but we really want you to have a bowel movement as early as possible. Other medication that we use is related to the fact that we don't use drains on anything that we do. It's a very mild diuretic and it's called hydrochlorothiazide. The short term is HCTZ. It's a very low dose of this medication, and it gets rid of fluid from your body. A lot of the pharmacies will ask you if you have hypertension, because it's usually used for high blood pressure. It's not being used for that in this particular situation. It's just to reduce fluid from your body. People tell you to drink a lot, very large amounts of fluid after surgery. We really don't want you to do that, because what happens after surgery is all that fluid will go into the area that we operated on. It can cause fluid collections, which are called seromas. So we want you to drink, stay hydrated, but only enough so your mouth is not dry. And this medication will be the one that you'll be using the longest. It's for 30 days after surgery. The last medication that we will give you is something that helps you reduce nausea. It's called Zofran, and you only take it if you're having trouble with nausea. Again, all of these things are going to be at the pharmacy, and please pick them up as soon as you can prior to surgery. The patient information sheet, which you probably already have, we will give you again in the preoperative period, and it really has pretty much all the information that's included here in this video, but we just want you to have it in written form. You can refer to it, and it's a very good source of information for you. If there are questions that are not answered, please don't hesitate to contact our office.